A 34-year-old with increased cholesterol and increased inflammation. He was a setup for a stroke. We're going to discuss this with you next. Welcome to Montgomery Heart and Wellness, and we have another clinical rounds for you. And today we're talking about a 34-year-old who presented to us after having gone to an emergency room because of a scare of a stroke. Can you tell the audience more about this?
Yes, so he went to our office to get more of a detailed evaluation to see what caused this surge in his blood pressure. His systolic blood pressure was greater than 180 when he went to the hospital, and he was very dizzy. And the imaging ruled out an acute stroke. They said maybe he had a TIA, but he wanted to figure out what the root cause of this high blood pressure was and wanted to make sure something like this wouldn't occur again because he is super young, only 34 years old.
And typically there are lots of underlying causes for these things. And someone who has a very elevated blood pressure, and I think he had some dizziness and some other neurological things. Sometimes it may be a stroke, sometimes it's just some non-specific neurological changes that occur with elevated blood pressure. But what we often do is we try to look at the underlying biochemistry. Is this person at risk for another event? And oftentimes, whatever caused that event, the elevated blood pressure, etc., can reoccur. So we want to say, okay, what are some of the underlying problems and what can we do to help prevent that? What are some of the findings that we saw that was interesting?
So we found high LDL cholesterol. So the bad cholesterol was 126, and better level would be less than 100. But we also found that a molecule called apolipoprotein B was high. So that binds the LDL to the arteries and plays a role in the beginning of plaque formation. So that was good that we detected that. We also found that the inflammation around cholesterol in the arteries was elevated. We look at something called lipoprotein phospholipase A2, and that was elevated, which means higher risk of an event, plaque rupture, heart attack, stroke. So the C-reactive protein was also high, kind of lining up with everything, high inflammation in the blood vessels. And then the lipoprotein A, which is a molecule produced in the liver, was elevated, and this molecule plays a role in interfering with clot breakdown, and it plays a role in the pathogenesis of plaque. So it's highly genetically influenced, but your data has shown the plant-based diet can dramatically lower that. So we had a lot of things going on that were very worrisome that we needed to work on.
Yeah, and so, and one thing I want to emphasize, and I think you outlined it quite well, these numbers indicate an underlying biochemical imbalance. Not only the increased production of cholesterol and plaque-forming molecules, but molecules that actually help lay down plaque. And so you think of blood vessels. When blood vessels are inflamed, that's a signal of injury. And the body's immune system tends to go to those areas of injury to repair. And these immune cells will take, cholesterol and those things to those areas of what's thought to be injury, but they're just inflamed areas. Why are they inflamed? They're inflamed for lots of reasons. It may be the toxic foods that we bring into our system, toxic beverages, excess sugars, animal proteins, fats, and these things cause increased underlying inflammation. And inflammation can exist anywhere or perhaps everywhere in some cases, and the blood vessels are a common area where you have inflammation. So you have inflammation, which then sends a signal out to the immune system, say, come and repair. And what happens is those immune cells go to those areas where they think there's injury, and they start to lay down plaque. But the plaque becomes very friable because that inflammatory process continues. And so inflammation plus increased plaque predisposed to rupture. If a plaque ruptures, then the cell is programmed to cut off, closing off blood flow. And so increased cholesterol to increase inflammation. If you go to your doctor, you have increased inflammation, ask them to check your C-reactive protein. If that's increased and your cholesterol is increased or other parameters of fat or cholesterol is increased, those are two things that could predispose you to plaque formation and rupture. So what do we do for this gentleman?
So we started him on a plant-based diet, the detox, more vegetables than fruits, and he had to travel a lot between different cities for work. So sometimes he did have some cooked plant foods oil-free, but he still had a really amazing improvement, actually.
Basically 6 weeks, what do we see?
So the LDL cholesterol, the bad cholesterol, went down from 123 to 102. And then that lipoprotein A, the molecule that also plays a role in plaque formation, went down from 195 to 144, which is a really huge drop. You really only see that improvement in people who go on a plant-based diet. There's not a magical medication for that. And then the inflammation went down significantly. So the C-reactive protein went down from 3.7 to 0.7, and less than 1 is a really good score. So that was awesome. And also the ApoB, that apolipoprotein B molecule that plays a role in really the LDL latching onto the artery wall, that went down as well. That actually normalized and went down from 106 to 85.
Yes, and this is pretty impressive because also the LPL-A went down by 51 points. That's roughly, if you say 20, that's like 25% reduction in LPL-A in just 6 weeks. Now, in our data, we saw a 16% reduction in 4 weeks on a defined plant-based diet. And so that's a pretty rapid change in a short period of time. And in most of our situation, we show how rapid and effective a plant-based diet can be, because this gentleman just came to us in a short period of time after presenting to the emergency room where he could have had a TIA or some stroke-like process that may have reversed itself. And then we find these parameters that were elevated. So can you do a nutritional regimen that can rapidly decrease these parameters and rapidly decrease this risk? And the answer is yes. So the power of plants cannot be overstated. Any final comments?
I definitely agree. I think this was a great example of how much we can even take our health into our own hands and improve things in a way that will actually reduce the risk of death in the long run.
Much agreed. So I hope you got a lot out of this, and until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.